Now let's talk about renal tubular acidosis. We've already talked about the basics. So now let's just bring it all together. So type 2 is when PCT, there's a defect of bicarbonate channel. Bicarbonate reabsorption doesn't happen. So effectively it is metabolic acidosis. Type 1 RTA is where H plus secretion doesn't happen. In the distal or basically the collecting tubule alpha intercalated cells, when this does not happen, this is basically again effectively more H plus in the body. So this is type 1 RTA. Overall, what is the most common type is type 4 RTA, wherein you have hypoaldosteronism. Alright, so aldosterone goes low, again H plus secretion suffers. Okay, what you want to remember is one poem here. So the poem goes 2, 1, 4, low, low, more is the sentence. Alright, so you pause the video and you recite it on your own. 2, 1, 4, low, low, more. So 4 and more are rhyming. Remember that, otherwise you forget it. Okay, so the type of RTA is type 2, type 1 and type 4. You just write what you were saying, 2, 1, 4, and then you make this table. The table starts off with potassium. So 2, 1, 4, low, low, more. And this is RTA over. Game is over now. So remember, type 1, potassium is low. Now, whoever is rank 1 in life, whoever are the toppers, they're always very greedy. They want more of everything. So they want more of calcium, they want more of pH, they also want stones. So we're gonna say, all right, you keep all of it. The other people, bichara, are all gonna have everything low. All right, so that is how we completely do RTA. Alright, so 2, 1, 4, low, low, more, and then you give topper everything, everybody else loses. So this is RTA for exams. Now let's just understand it one more time. So type 2 RTA is the proximal tubule. Remember, type 2 RTA, you have Wilson's disease, which is one cause, and you have Fanconi's disease, which is a failure of reabsorption of everything in the proximal tubule, are all causes of type 2 RTA. Alright, so what happens here? The calcium is low, potassium is low, so the pH is low. So here the pH which I'm talking about is urinary pH. Alright, so the urinary pH is going to be low because bicarbonate reabsorption is not happening. In type 1 RTA, what is happening? Potassium is again low, but calcium is going to be high, and urinary pH is also high. Urinary pH is high because there is failure of H plus secretion. Yeah, I hope you understand that. And nephrolithiasis is associated here. With type 1, you want to remember type 1 for Sjogren's. Alright, so Sjogren's syndrome, autoimmune A1 is what you can remember, are all going to be causes of type 1 RTA. Type 4 is hyperaldosteronism, and remember, one of the common causes of this is obstructive uropathy. Alright, so obstructive uropathy is one of the causes. So this is RTA in a nutshell, a very difficult topic otherwise. We just remember one poem in the